webinar, and I'm so happy to introduce you to the three amazing doctors that we have today to talk about sexual health. Let me start with Amy Killen. Dr. Amy Killen started out as an emergency room doctor for a very long time, and then fell in love with regenerative medicine. And a lot of what we're going to be talking about today happens to fall into the category of regenerative medicine. So Amy is doing some very leading edge work in the area of sexual regenerative medicine. And then I'd like to introduce you to Lamia Gabal. Lamia is a board certified urologist in the Southern California area of Orange County. And she has patients both across the gender spectrum, as we like to say these days. So she is a urologist, but she is also working with women from a gynecological perspective. And often when you're dealing with sexual health, you're dealing with heterosexual monogamous couples as the norm. And often it is not just the patient that you're dealing with, but also their partner that you have to be sensitive to. So Dr. Cabal brings a lot of great wisdom as a Gainswave provider and doing many other things. And last but never least, Dr. Judson Brandeis. Dr. Brandeis is a board certified urologist. He was director of urology at John Muir Hospital. He also is a Gainswave clinical director of data, and he is doing a lot of primary research in the sexual health industry. And so he not only sees patients, but he is also someone who is collecting the data to show the positive effects of treatments for sexual health like Gainswave. And we are going to cover a number of things for you today. The first is what's been happening from, I'd say like a trend perspective around coronavirus and sexuality. As you can imagine, it runs the range from people who are taking this time of sheltering in place to work on their sex lives, all the way to the other end where divorces are up. So we're going to talk a little bit about that to get kicked off. And then I really wanted to get into new trends in sexual health, because I know that for myself, as well as Amy, Judd, and Lamia, we are on a lot of summits and podcasts and doing a lot of publicity now where people want to know about how they can retain or reverse the atrophy of aging and stay sexually healthy their whole life long. People are becoming aware of the fact that sexual regenerative therapies are available and they want to know about them. So we're ever more popular these days, which is great. And then we're going to talk about the biggest pain points that our doctors are seeing. So each one of our doctors has a slightly different style of practice. And we want to get to, okay, what are the top 3 reasons people are coming to see you now in today's world, and how has that maybe changed over the years with some of these new capabilities? We're going to talk about erectile function, because erectile function is as important for women as it is for men. Oh yeah. And women do not need to be pushed to the side in discussions about erectile function. We need to be right up front and center with our men. And so we're going to talk to you about why that is and how it's impacted. And finally, we're going to talk a little bit more of a deep dive into some of these hottest sexual regenerative therapies, because Gainswave is actually part of a stack, if you will, a series of synergistic modalities that can be employed together to really get people to a highly functioning experience of pleasure and connection. So we'll also be taking questions, and you are welcome to type those into the chat. And Adrienne Gonzalez, who is here with us, as well as Shay Gordon, will be collecting those and putting them in for me to make sure that I don't miss them as I'm, getting the questions answered from all of our experts. So that's how we'll go today. We'll go as long as you'd like to, but we're looking at about an hour of attention. So let's get started with the first question, which is coronavirus. How have the last 5 months of life with coronavirus changed the priorities and the conversations that you're having with your patients? What impact is COVID having on people's lives? And I'd like to start with Lamia on this question.
So I'd have to say, I've seen the coronavirus affect my patients in so many different ways, and it really does run the gamut, as you had said earlier, from people trying to avoid sex because of their anxieties or having a decreased libido because of the coronavirus and everything that's going on in our world, to completely the opposite. And I have to say, I think this is probably more what I've seen in my practice, and it makes me happy that people are wanting to have more sex, because they're sheltering in place and there's nothing else to do. And I think that some of my my colleagues, my OB colleagues, are looking forward to a baby boom. I think about 9 months after March, where we might have to see some names such as Rona and maybe Covey, I don't know. But I think that it really has been helpful because people are at home. There are studies that are showing that people are researching more of their dysfunctions. Now they're at home more. They have more time to actually put into this, maybe more money because they're not traveling. And I have to say that in the last couple of weeks alone, I've seen an increase in my Gainswave consultations. And Gainswave, which I'm sure we'll talk about later, is the elective treatment for erectile dysfunction, for regenerating normal tissues. So, I mean, it really is something that's been picking up lately for me. I don't know about you guys.
Yeah. So, Judd, you have done some new research and you are seeing patients. How have things changed for you with coronavirus?
Susan, we focus really on three pillars. We focus on feeling good, looking good, and having better physical intimacy. And I think one thing that I've seen in a lot of men is that they put on weight. So because gyms are closed, because it's difficult to get out, people in general are less healthy. They spend a little bit more time cooking, so they're not eating out as much, but they're eating more. And so I think that overall puts a drag on people's overall physical fitness.
Yeah.
Now, I definitely have seen coming together, I think, of a lot of couples, couples that actually enjoyed spending time together, and either the husband or the wife or both were out working or sort of trying to climb up the corporate ladder. I have seen a number of nice stories of couples that finally had more time to spend together. And that obviously has manifestations of physical intimacy also. And so that's been really nice. But then on the flip side of that, I have had a lot of couples come in because, when they do find time to finally have physical intimacy, they find that things aren't working quite as well as they used to. So it's been sort of a mixed bag. People are not quite as in good a physical condition, but I think overall they're eating a little bit better. They are having more sex, but they are finding in some instances that things aren't working quite as well as they used to.
The quarantine 19, right? The
Yeah.
extra 20 pounds that we all got from all that good home cooking.
Absolutely.
I love it. And it is interesting that people not traveling is giving them more cash to spend on their health, which is excellent.
It is.
Amy, one of the things that I wanted to know if you could do, because I want to get it out really early in this conversation, is to talk about how Gainswave works when you're answering the how have you noticed coronavirus changing your practice. Would you also just do that kind of quick and dirty overview of exactly what the heck is Gainswave?
Sure. So Gainswave is it's a device that we use in the office, basically to deliver high intensity sound waves, or shock waves, as they are sometimes called, into the penis. And what we're trying to do is essentially activate this whole cascade of healing that leads to increased blood vessel formation, so you get better blood flow over time, increased nitric oxide, which is again a blood flow inducer, and actually stimulating stem cell recruitment. So you actually have regeneration of those tissues. So it's a series of treatments that we do in the office, over 3 weeks or 6 weeks or something along those lines. And it's a non-invasive way to actually repair some of the damage to the penis that has happened due to aging or chronic medical problems or things like that.
And so have you seen, what's the Gainswave and kind of overall awareness of regenerative sexual health? How has that changed over time since you've been practicing in the regenerative area?
I've been doing regenerative medicine now for about 7 years, and Gainswave for like 3 or 4. I was one of the early adopters. And definitely people know what it is now. Have patients calling, and they've seen ads, and they've seen, various people talking about it. So people are learning more about it. We're getting more and more calls about Gainswave, as well as some of the other therapies that we do for this, which is exciting, because I think that, just getting the word out that you don't have to just take medication for the rest of your life, or that, or have body parts that aren't working like you want to. You can actually do something about it, which is pretty awesome.
Yeah, I think that Viagra did a very good job of making the world aware that blood flow and vascular issues were a problem. And now men are realizing, if I do Gainswave, I don't have to take Viagra. I can, or if I do, I have to take a lot less, and maybe I don't always need to rely on it, just depending. Yeah, you and I kind of started, you were about a year ahead of me in the discovery of how amazing Gainswave is. And it was funny because, like you, I think the minute I realized how effective it is for men, I wanted to get behind it. And about 6 months ago, I was on a bus at an industry event. And it turned out that it was with a lot of men who were into the world of fitness, bodybuilders and kind of celebrity fitness people. And they were all mid 40s, early 50s. There were a whole bunch of them. And I was sitting in the bus, and I heard a couple guys, 3 guys sitting behind me. It was like a bench seat, 3 guys sitting behind me talking about how they go get Gainswave every year just to keep everything from, atrophying. It's like one of the things that they just do as a natural course of things. And that leads me to my next question. And what I wanted to know from Judd is you have a lot of very unique things that you do. You do penile implants, and you do a lot of reconstructive surgery from prostatectomies. I always have a hard time with that word. You're always trying to teach me how to do that right. What is it that you think is your area of unique expertise that makes you different than almost every other urologist out there? And then I'll also ask Amy and Lamia to weigh in on that question. But what's the sexual regenerative knowledge that makes you so amazing and special? And you all are to me, so I say that with pure conviction.
I think the issue is that I've done this from the inside out. So I've operated on penises, I've injected in penises, I've repaired penises, I've cystoscoped penises. I mean, there's really hardly anything surgically that you can do to penises that I haven't done. So I really understand it from the inside out. And then in terms of treating erectile dysfunction, I try to have an approach where I have every tool at in my toolbox. So whether it's nitric oxide boosting supplements, PDE5 inhibitors, shockwave, Gainswave therapy, vacuum erection devices, traction devices, PRP, even stem cells, amniotic fluid, PT141, apomorphine, oxytocin, and then things that we're developing also. So, and then obviously trimix injections, and then placing of penile implants. And so really, when I look at a patient, I look at their overall health, their overall circulation. We work with vascular labs. I work with dietitians. I work with exercise physiologists, cardiologists to assess overall. I have a sex therapist that we work with. So we really come in with a totally holistic and integrative approach. But at the same time, we also come in with a surgical approach, and we really have access to all of the newest, latest, greatest information. I'm always going to the Sexual Medicine Society meetings and the International Society of Sexual Medicine meetings, so that we're always keeping our pulse on whatever is coming down the pipe.
I want to talk later. I have a question about top tools at the end, and I want to revisit PT141 because it's something that I've been testing it on myself, and I want to talk about peptides a little bit and the melanotan pathway, et cetera. But you said a word, you said a thing I didn't know, like atheros, something. What was that thing?
Apomorphine?
What was it, Aim?
Apomorphine is what he said, I think.
Yeah, what's that? Can you tell me what that is?
So it's a receptor in the brain that's an alternative pathway, sort of like PT141, and so it's just another thing that it's not a primary tool that we use, but it helps some men achieve better erections.
How do you spell it?
APO, morphine, morphine.
Is it a derivative of morphine or is it a peptide?
It hits like a morphine type receptor up in the brain. It's a pill. Yeah.
Oh, that's so interesting. I'll have to. That's a Googler one for me.
I
I love it.
have a webinar on my website if you're interested.
Oh, great. What's the URL?
Just www.brandeismd.com.
Brandeis MD. Perfect. I got lost. Am I at Lamia or Amy on this question? Did you guys?
Yeah.
Amy, did
Lamia, you can go.
You go, Lamia.
So I have to say, I think as a urologist who specializes in female pelvic medicine and reconstructive surgery, that's my area of expertise. I think I have a particular knowledge of the female anatomy. And in working with both men and women, I have lots of couples in my practice who both trust me with their sexual health because, you know, some women may not feel comfortable talking to most people about their sexuality, or they're not encouraged, you know, by their primary care doctor or even their gynecologist because they don't have time to talk about their sexuality. But if either of the partners comes in to see me, then I'm available to talk to both of them. And I think that's something unique in my practice. And we offer all kinds of regenerative therapies for both men and women, but the Mona Lisa is a laser for the vagina that works incredibly well, I can tell you from personal experience, and that helps to regenerate younger, healthier tissue. Gainswave for the men for erectile dysfunction, and then FemiWave is something that I'm going to start bringing into my practice, which is Gainswave for female orgasmic dysfunction. And then PRP also for men and women for regeneration. So I just think that it's important to treat both partners in the relationship because they have to match. They have to match.
One of the things that when we started out, I started out by saying erectile function is equally an issue of the feminine as the masculine. And everyone thinks erectile dysfunction is an issue of men, but we have the same amount of erectile tissue. Ours is just 95% of it is inside. For the masculine, half of his is outside, but we're dealing with the same core amount of tissue that loses blood flow, starts to thin, starts to atrophy, loses sensation. And that is one of the things that I really like about having Gainswave / FemiWave, the same equipment used on our equipment. I really like that combination. And one of the new technologies that I think is really promising also is this VFit device. Have you started carrying these in your practice? I think they're very nice. They have the red light therapy. And so it's kind of a do-it-yourself at home device that you can use for increasing the tissue density of the vaginal mucosa. And so I like that there's so many things that can be done internally, externally, to the clitoris, to the entire penile structure, et cetera. Amy, stem cells are really, when I think about you, I know you do all of these different modalities that we've already talked about, but when I think about you, you are, you know, the doctor of sexual stem cells. I don't think that I'm wrong in that. That's what you would have said when I asked you to tell me your expertise, correct?
That sounds great to me. Yeah, I'll take it.
So why don't you just give a little bit of information about what's happening with stem cells? Are you taking the iliac crest stem cells? Are you using mesenchymal stem cells? Are you doing combinations? You know, kind of what's the gold standard and how do you determine budget for money around stem cells and genital rejuvenation?
Wow, that's a great question. So there's, you know, it's a very new field and it's been investigated obviously for several years, but there's still new information coming out all the time. For stem cells, we're always using almost always using mesenchymal stem cells, which are adult stem cells. So you're not using embryonic stem cells is the main point of that. We're not hurting any fetuses. These are all coming from either adults or from placental tissue, of healthy newborn babies. In my practice, we tend to use what's called autologous stem cells. So we try to use stem cells from the patient, as long as they're relatively young and relatively healthy. Most commonly, we'll do a little mini lipo aspiration, like a little mini liposuction, kind of in the flank area, like the love handle area, and just get a little bit of fat. You don't need too much, and isolate the stem cells that way. You can also do a bone marrow aspiration, which we will also do in our practice as well sometimes. Those are similar types of cells. It's just concentrations are a little bit different, and some of the messaging is a little bit different. And then we also use quite a bit of growth factors like exosomes, which are sort of like the growth factor components of healthy umbilical cord stem cells from placental tissue or amniotic tissue. So a lot of my procedure, I do big procedures. So I work with a partner and we do these big cases where we'll actually get stem cells, from the bone marrow and or the fat, and then we'll add in something like exosomes and PRP, platelet-rich plasma, which just comes from blood, and inject all of those things into both into the genitalia of men or women. And as far as the studies go, there's still, there's studies to support kind of each of those things, but they're all very small, small numbers of people looking at mostly in men. Mostly men are studied for stem cells, but there's definitely some interesting things that we've seen. I've had some really great stories, success stories that it makes my heart sort of pitter patter. But then I always combine my stem cells with the Gainswave, with the nitric oxide boosters, with the hormones. So, I'm not coming from a urology practice. I'm a, emergency medicine and integrative medicine. So I don't do surgeries. I always refer that out to my urology friends. So I'm always doing things that are relatively non-invasive and trying to get the body to heal itself is kind of what I'm going for with my patients.
If you're looking at a man who is 55 years old, whose body mass index is reasonably low. He's not overweight. He's not buffed. He's your average dad bod guy. And he has trouble maintaining an erection, which is venous leak, most common issue. You taught me that, Aim.
Oh, good.
Yeah, I you talk. And he has, and there's two exact men exactly like that. You can tell he's on his way to full erectile dysfunction. Viagra's been helping, but he's getting a little bendy. One guy he's on a budget. The other guy, he's got flush with cash for his bedroom experience. What do you tell them to get? What's the minimum stack and what's the throw it all at 'em stack?
Ooh, that's a good question. I guess I'll start since I was already talking, but for the minimum stack, I think start with the foundational stuff, start with exercise. So we know that exercise and erectile dysfunction, they're opposite. So the exercise is great for getting blood flow where it needs to go, losing weight, kind of helping revive some of that tissue. Diet, I know it sounds redundant, but diet's very important as well. Anti-inflammatory diet, low sugar diet, anything that's good for your heart is generally going to be good for your penis. So just, I tell patients, they hear that all the time. These foods are good for your heart. This exercise is good for your heart. Low stress is good for your heart. Sleep is good for your heart. All of that is also good for your penis. So if you're on a budget, start there. Or even if you're not, start there. Yeah. And then you can add in the fancy treatments after that. But for me, that's where I start.
So what's the minimum that you could do? Let's just say maybe for the guy on a budget, Gainswave with a vacuum erection device and P-shot. The guy with plenty of money, what are you going to give him? Or you do that for me. Tell me what that is and tell me what it's going to cost.
Ooh, that's
approximately.
I think the cost, maybe you guys can answer this. The cost is very different depending on where you go, exactly what procedures you're doing, if you're doing stem cells, where you're getting them from. Like, there's a lot of variables there. So the cost could range from just a few $1,000s if you're doing sort of Gainswave, PRP, P-shot, to a lot more depending on kind of how far you go and what you're using.
Well, if you're just using all of the best exosomes, mesenchymal stem cells, plus all that other stuff, how much are the stem cells running for sexual regenerative therapy right now?
Are you guys doing stem cells?
I'm not doing stem
Not
cells.
really.
Yeah.
With my procedures, we're generally taking stem cells from the patient, like I said, and there's a procedure cost to that, but then we oftentimes will use them for several different injections. So for instance, I do a lot of skin injections, I'll do hair injections, my partner does joint injections, musculoskeletal injections. So oftentimes we're doing sort of this bigger procedure, and that's why people come to us. So I rarely have someone that comes in just for stem cells for the penis, because that does become kind of cost prohibitive. But if you're if you're getting the stem cells, you're paying for that part once and then using them all in different parts of the body. It's not quite as, as high per body part.
Yeah. By the way, I think when we're talking about sexual regenerative medicines, you've got to talk about hair and face, especially women with face, but more and more men these days too. The PRP injected into the scalp for hair regeneration is absolutely fabulous, as are all of the PRP facial injections. Oh my gosh, they are so much better than going and getting the Botoxes and the Fraxels and things like that. I would never go back to the old dermatologist way of things. I would only go to someone who's doing PRP-based regenerative treatments. So this is not just for the genitals. PRP is wonderful everywhere. And I think someday, tell me what you guys think. I'm thinking like 15 years from now, stem cells are going to be as common as PRP is today. It always feels like it takes 15 years for stuff to really become mainstream. Like Gainswave, I feel, is starting to hit mainstream. You talk to the average guy who's kind of paying attention to his health, he knows about Gainswave now. 2 or 3 years ago, he had never heard of it. 3 years ago, he hadn't heard of it. Last year, he'd heard of it, but he was like, I'm not sure. What are you going to do to my penis? Now he wants it and he's saving up his money and he's going in and he's getting it. That's how fast that happened, I think. Don't you?
Yeah, well, I have to say, I think, Viagra, as you were saying earlier, kind of made it more mainstream to even talk about these things, right?
Yeah.
Where when I was a resident, I don't know, I'd like to say 10 years ago, it was like 20 years ago, a man would come in with erectile dysfunction and we'd say, I'm sorry, it's all in your head. Go home, have a glass of wine, maybe try some herbal yohimbine that, there's not much else we can do for you. But then, when it was found by accident that it gave this amazing side effect, right? It was being studied for blood pressure and this amazing side effect that it helped for erections. Well, then the very smart drug companies came out and started marketing it. Now it's a household word like Kleenex and Coke and, Viagra. So that's made it so much easier for us to talk about this stuff. And I think for all of this stuff now to follow, I think would even become more mainstream more quickly. So, I think Gainswave has done a great job also in making it known and getting it more into the mainstream. So many men are just Googling, erectile dysfunction and then they're learning more about this and they don't want to take medications. They want to be more healthy. They want to keep what they have or try to get, I tell them I can get you back probably 10 years, depending on how far, they want to go with it. And a lot of it is maintenance. I come from an auto parts background. My dad, it was called King Tut Auto Parts here in Anaheim. So I tell them, we maintain our cars. We need to maintain our bodies as well. And then it's going to work a lot better for us many years down the line, just like we do for our automobiles. But stem cells too, I think we're learning so much about them. I mean, to your point, Amy, it is something that we're learning how many benefits that stem cells have for so many different organ systems. And even gene therapy is something that's coming into play. There's phase 3 trials now for different trials and different things that we can do with gene therapy. So exciting, I think, to live in this day and age. And
can you go into the gene therapy a little bit more and explain that for us, please?
Well, I'll share with you something. My daughter, who is 16 years old now, was born with a metabolic disorder called ornithine transcarbamalase deficiency. And those of you who've been through medical school probably hated the urea cycle as much as I did. And it's something you learn and unlearn about 20 times during your medical school life. But anyway, so she's missing an enzyme to metabolize her protein. And basically was in a coma when she was a year old. And then we learned that, we were able to give her a low protein diet. She has to have a low protein diet, otherwise her liver can't metabolize protein, and her ammonia levels go up and she gets brain injury, and it's very complicated. But if you saw her now, she's a normal 16-year-old just taking, she rolls her eyes at me and likes shirtless teenage boys, and everything we thought she'd never do when she was a year old, and it looked like she had stroked 3/4 of her brain. But specifically for that disorder, they're in phase 3 trials now at UCLA taking a viral vector. So this is what gene therapy is. You take a virus, you add the DNA into that virus, and then you infect the organ or the body, the total body, with that virus that now can incorporate itself into the cells where it's needed to now produce this enzyme. And so, for Layla's disorder, it's actually the perfect place for it because she's missing something that we can now have that created. And hopefully in the future, once we get through these first initial bumps with gene therapy as a whole, there's so many other applications that as we see that as we get older, our enzymes, our genes stop working, well, then we can reinfect our bodies with younger copies of these genes that can now maybe create things for black hair, or things for, for penile function, or things for your collagen regeneration. So it's super exciting. And that's way out on the horizon for regenerative medicine, but I think it's super exciting to see where we're at with that.
Well, I love way out in the horizon. And Judd, I wanted to ask you a couple of questions about that. One of the things that Lamia mentioned about, let me see if I can collect it the way I want to say it. This is about premature ejaculation, where, Lamia said when people would come in to her office 20 years ago, they thought, ED is all in your head. And now 1 in 4 men, of course, suffer from premature ejaculation. And you have a product, Prelong, that is a supplement that helps men overcome premature ejaculation. I wanted you to talk about that. And also, I'm going to give you a 2-part question, Judd. The second thing that I want to talk about, because I think that PT141 is a peptide for libido and arousal, desire and arousal, is very interesting, because I wonder if the melanocortoid pathway is one of those things where when people have difficulty getting an erection from the, standard pathway, I'm wondering if PT141 is something that compensates for something missing in the genetic profile. Get your opinion on that as well. So if you take that 2-part question, I'd appreciate it.
Sure. Great, Susan. So as far as premature ejaculation, it's a really difficult thing to study. Rats don't complain to each other about premature ejaculation. So there's no rat model like you could do for erectile dysfunction. And even, with humans, it's hard to do an MRI of somebody's brain at the very moment that they're reaching climax. That the MRIs are very claustrophobic. It's hard to get 2 people in those MRIs. They haven't built those quite yet. So it really is a difficult thing to study. Now, one thing you can use are numbing creams. So there's Promescent, there's KY Duration, there's a whole bunch of numbing creams, but it sort of almost defeats the whole purpose of having intercourse, of numbing things, and then sometimes it transfers to the woman, and so she's not so happy. So it's one of the treatment modalities, maybe not the best treatment modality, but it's one of those things that everything is kind of incremental. So if that gets Guy to go from 30 seconds to a minute, then the other thing that we found out is that selective serotonin reuptake inhibitors like Prozac and Zoloft and Lexapro delayed ejaculation, and in some people it makes it really, really difficult to even them to achieve climax. And so we figured out that it must have something to do with serotonin. And there's actually a medication called Prilogy, which is a short-acting selective serotonin reuptake inhibitor. Because the thing is, it's hard to know 4 to 8 hours beforehand that you're going to be able to have intercourse to time taking those medications. And a lot of people don't want to take those medications on an ongoing basis because they have a lot of side effects, and there's a stigma for taking an antidepressant, especially for something like premature ejaculation. Now, what they found was that there's an extract of St. John's wort that acts as a selective serotonin reuptake inhibitor, but it doesn't have the same side effects and stigma of taking a pharmacological grade selective serotonin reuptake inhibitor. So we developed Prelong, which is L-citrulline, which is a nitric oxide booster, but then also hyperforin, which is an extract of St. John's wort, which increases serotonin, which delays ejaculation. And then, of course, there are psychological and behavioral techniques that you've helped to pioneer. And so it's really a combination approach, the same way that we go after erectile dysfunction with triple therapy or quadruple therapy with a nitric oxide booster and PD5 inhibitor and Gainswave and pumps and PRP and stem cells. With premature ejaculation, it's the same sort of thing with psychological therapy, with the start and stop technique, the me breath, and then something like Prelong, and then if all else fails, selective serotonin reuptake inhibitor. Okay.
Thank you.
You're welcome.
Yeah, that was a good one.
And then part two. Yeah, yeah, I mean, there's not a whole lot known really about this melanocortin pathway, but it's really interesting that there are other pathways, like the morphine pathway that the apomorphine hits, and the PT141 that we kind of are finding out by accident. And here again, maybe it's one of those things of a combination approach that helps. Now, the nice thing about PT141, and I haven't unfortunately tried it yet, but I have patients that say that it really works for like 8 hours in them. So the variability of response is pretty wide in PT141, whereas the pharmacokinetics of a PDE5 inhibitor like sildenafil or like tadalafil is very, very predictable across the board. With PT141, it's very variable. Some people get really bad nausea and can't really enjoy the effects of PT141. Some people it works in an hour. Some people, they wake up the next day and all of a sudden it's working. And some people it works for maybe 3 or 4 hours. And some people I've had say it works for them for 12 hours. And so now once you figure out how it works for you, does work fairly consistently. So, if you have issues with premature ejaculation and you take PT141, if you swing and miss the first time, the good news is that, you probably have 6 or 8 hours to give it another shot.
Yeah, the PT141 is a very interesting thing. It's a peptide that some manufacturer, I forget who it is, made a product called Addy for premenopausal women with hypoactive sexual desire disorder. Now, I don't even like the word hypoactive sexual desire disorder because I think it's a bunch of crap. Personally, I think that those women aren't getting what they need, whether that's safety, stimulation, I think there's a lot to unpack with that, but to call someone, to say someone has a lack of sexual desire as a, a reason to prescribe a drug, I don't know. The world does things in a lot of different ways. Lots of people like lots of modalities. So I want to do a lightning round with the three of you. Lamia, you go first on this one. And what I want you to, just to tell me, boom, 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 and you can do it for men and women too, if you want to, not a problem, is what are the 3 main reasons people are coming to see you now? What are your 3 biggies? And I'd like each doctor to answer the question. And if you can do male and female, do it.
I think for my female patients, again, because of my specialty, and I do a lot of pelvic floor reconstruction, incontinence, prolapse. So number 1 for the patients coming to see me for women would be incontinence. Number 2, probably urinary tract infections, recurrent UTIs, that goes along with their prolapse stuff. And I think at the bottom of the list for women would be their sexuality, at least for the patient population that I'm seeing. I would like that to change, and I'm working on it. I'm trying to get more women to be talking about their sexuality. For men, number 1 is their erections. That's definitely why men come in to see us. They don't care if they're having trouble urinating for the most part, or if they're even seeing blood in their urine. That doesn't normally drive them in. But yes, number 1 would be their erections. Number two, I think, would be having difficulties urinating. And then number three, I think for some men would be prostate issues, which goes along with number two, really.
Great, thank you. Amy, how about you? What are your 1, 2, 3?
I see a lot of men with erectile dysfunction for sure. For women, I see a lot of orgasmic problems, whether that's delays or just not kind of being as good as it used to be. And then I also see just a lot of low libido, in really both sexes, but especially in women. I have a lot of women who complain just lack of sex drive, like you just kind of talked about. And obviously that's more complicated than just focusing on one area of the body. It's really like a whole systemic thing oftentimes, but that's when they come to see me oftentimes.
Thank you. And how about you, Jed?
I see a lot of men for erectile dysfunctions. I see a lot of men for testosterone replacement. And then since we're doing a number of clinical trials in the office, I'll see men for erectile dysfunction. I'll see men for Peyronie's disease. I'll see men for orgasmic function. I'll see men who want to have a longer penis. And then we're also developing a transdermal nitric oxide boosting supplement. So those are sort of the 5 things that we have going on. So guys are coming in for either research protocols, ED, or low T.
ED and low T, they go hand in hand. All right, this is my area of how I'm in my happy place now, because we're going to talk about erectile tissue, structures, anatomy, function, and what I'd like each of you to do. And Judd, I want to start with you. I would like you to, and I know your area is the penis. You're not going to be able to talk as much in comparison of the female genitalia, but do what you can. I'd like you to tell us how they're the same, how they're different, erectile response, what's the tissue like, what kind of other tissues are there? Give us a anatomy insider's secrets conversation here.
Sure. So, I've done a lot of female pelvic reconstructive surgery, robotic sacrocolpopexies, cystoseals, rectoseals, enteroseals, slings. So I am pretty familiar surgically with that tissue. But, so the interesting thing is men and women develop the same, right, embryologically. And then at a certain point in development, certain hormones kind of turn things on and turn things off. And so surgically, if you go looking, you actually can find residual female tissue in a male and vice versa. But so, for example, the clitoris is basically the penis, but inside out. And so some of the same things that work for erectile dysfunction work for female sexual function. And that's why things like FemiWave and things like estrogen and all the things that increase circulation to the female parts are critically important. Now, women, I think, are a little bit more complicated than men, and they have different parts of their brain that get activated in different ways. And so I think that's the key, is to stimulate a man in the way that he wants to be stimulated, but also stimulate a female in the way that she wants to be stimulated. And that's what the, quote, hypoactive, I agree with you. It's, in medicine, we just try to throw some fancy Latin term onto something to make it seem like we know what we're talking about. And then we can give, everyone wants a pill, so we can give them a pill to treat this fancy Latin term. But, I like what Amy said, really, which is the best things in life are free. If you're exercising every day, if you're eating right, if you're drinking enough water, if you're watching your cholesterol, if you're meditating and you keep your own, personal mindset, so you're not getting depressed and not getting stressed out, those are the most important things for a happy sex life, and to keep blood flow pumping to your penis. Now, there are other really simple things you can do, like taking a nitric oxide booster. I'm a big fan of nighttime erections, so I put most of my patients on tadalafil right before they go to sleep. These days it's generic, so in my office it's $1 a pill. I mean, you can spend less than a cup of coffee on a nitric oxide booster and taking tadalafil that'll keep your erection strong for probably 10 more years than if you didn't do that. Mm-hmm. And then even something, if you're in your 60s or 70s or 80s, something like a penile pump, you know, that's $200 or however much it is. And that's something that will help continue to stretch and bring oxygenated blood flow into your penis to prevent fibrosis, prevent shrinkage of the penis. I mean, guys go all over the world to try to make their penises longer. Just get a pump.
Yeah.
You know, keep it stretched out. So, you know, we all of us that are here are Gainswave providers, and we do PRP or we do stem cells or we do things that are fairly costly, but obviously the easiest stuff is the cheapest. It takes a commitment for healthy lifestyle and a commitment to do things like pumping or taking a nitric oxide booster or PD5 inhibitor that sometimes are a little awkward or uncomfortable.
I want to make a point too, Judson, something I think that you were kind of alluding to is that the earlier you start with the regenerative stuff, the easier it is to kind of keep the function. So when you see an older person who comes in, you know, when I see a guy who's in his 80s and now he's got a 50-year-old girlfriend, now he wants it to work again, you know, it's going to be more difficult to get things going as opposed to if they had kept the maintenance up the whole time. I tell them the penis is a use it or lose it organ. The vagina is kind of the same.
Yeah.
And you really have to keep the blood flow going to those organs to keep those cells pumped up. And if you don't, things atrophy, they shrink, and it becomes much, much more difficult to regenerate those organs the longer you go without the regeneration.
Yeah, I totally agree. I mean, I'm 53. I was a triathlete and a runner, so I have a good cardiovascular system. But, you know, my goal every morning is to wake up with an erection, and I load up on nitric oxide boosters right before I go to sleep. Because I know that if I'm oxygenating and stretching my penis, then things are going to keep working.
Yeah. Well, and plus most of your nitric oxide production it actually happens at night. So taking nitric oxide before you go to bed is the best benefit. Silly to take it in the morning, take it at night and before sex, right? Amy, do you want to say anything about erectile tissue, the masculine and feminine? Any insights that you've gleaned over the years of working on patients, things that you don't think that the average bear would know?
The biggest thing that came to mind when you guys were talking is, obviously there are all these embryological similarities between the male and female tissue. But I think what's interesting about women, and at least what I've seen, is that they are a little bit more complicated. It's not just about getting the blood to go into that area. With men, if you can get blood into the penis and keep it there, like that's a home run. And with women, we know from the use of Viagra, which only works a little bit in some people, it's not just about blood flow. You really do have to think about the mental, emotional component much more. There's a lot more sort of discordance between, what a woman is kind of thinking and wanting versus what the genitalia is thinking and wanting. And you got to get those things to line up. And, I tell my female patients, it really is, their libido and their sexual interest starts, in the morning when they go to the kitchen and their sink is full of dishes and their husband or wife didn't do the dishes, and that all of a sudden puts them on the wrong track. It's a lot more complicated, I think, for women. So even though the anatomy is similar, the actual getting the response you want and having the fulfillment you want, I think is actually quite different.
Yeah, one of the things that I've been doing a lot, I'm in high demand in the ladies groups right now. It's very interesting. I wish more, I've got that. Thank you for that question, Adrienne. I will circle back and get that. I wish more men's groups were talking about sexual health, but I'm glad to see that I was just on a Facebook Live this morning, Beyond the Red Tent. And when I talk to women about how much erectile tissue they have, they're always amazed. And the thing that I've been using lately is, I call it the banana diagrams. It's the analogy of a banana. Here's your banana, so you know what a penis looks like. Pretend that's the penis. 50% of his erectile tissue is sticking out of his body. 50% of it's going in and down. The penis actually looks like a tongue. Women are like, really? Amazed by the anatomy of that. And then I say, you have all that same banana full of erectile tissue, only the stem is what sticks out, and all the rest of that banana is wrapped around your vaginal opening, the clitoral arms, the vestibular bulbs, the head and the shaft, the urethral sponge, the perineal sponge on the bottom. And when women realize that they have as much erectile tissue as their male-bodied partner. And then they also understand that it's literally a bracelet of tissue around the vaginal opening. They can begin to believe that it was not true, that they're just not the kind of woman who can have an orgasm from intercourse. Now they think, oh, if I just got the blood flowing around I like to call them the golden handcuffs. It's like two interlocking systems of erectile tissue in there. Once they get all those golden handcuffs full of blood, they're naturally going to start having orgasms from intercourse. So I do hear from women that their number one sexual issue is either painful sex or inability to orgasm from intercourse. They have one little way maybe they can orgasm, and it's usually not penetration. So I do really think that there's kind of a leading story. The big trend is this awakening of women to their own anatomy and the physiology of erectile tissue function, that we're all telling people women are becoming aware and they want to know. And pretty soon, men are going to start thinking about self-care, getting ahead of the curve, not letting it atrophy. It's all happening. And I think for many men, the awareness of Gainswave, where they think to themselves, there's an alternative to Viagra. It's Gainswave. And how Gainswave works is it stimulates new tissue to increase blood flow. And when they start thinking about it that way, then they start saying, oh, I need to get walking again. I do need to watch like starting out with diet and, starting out with nutrition and exercise are like, ugh. But when you start to directly connect it to the fact that they've got this tissue that they need to take care of, it seems to get them interested. So I want to, first of all, thank all three of you very much for all of the work you do day in, day out, one person at a time, and all of the work that you do getting on events like this to spread the word about people's potential for pleasure and connection, because that's really what it comes down to is, yeah, we're working with the hardware and the software, but what we're creating is the experience and connection. So before we get off, we have a couple of quick questions. Erica Miley, one of my very favorites, is on, and Mark and Rebecca Pulley are here with us, both of them. Hello. I'm so glad you came to this today and got to meet some of my favorite doctors. Erica wants to know, at what age could or should a person start preventative supplements? I think, Judd, I'd like you to answer that one because you invented a line of supplements with Affirm Science. That's a natural question for you.
Well, thank you, Susan. And thank you, Erica. I think 40 is probably a good rule of thumb, but I have patients who are in their 30s that come in that aren't in particularly good health. They're overweight, they have a sedentary lifestyle. And, and in addition to lifestyle issues, it's important to start a nitric oxide booster, and especially before you go to sleep at night. And then I think as a general rule, men starting in their 50s should start a nitric oxide booster. And there are all sorts of supplements out there, but very few have as strong data as a nitric oxide booster. And when you begin to take nitric oxide boosters, you really see a dramatic difference, not only in erectile function, but a lot of elite endurance athletes take nitric oxide boosters. A lot of people notice improved cognition. I have patients who are diabetics that take less insulin. I have patients who have neuropathy that tell me that they have less neuropathic pain. It's not that it affects the pain per se. It's all just a matter of circulation. Circulation really is what makes everything better.
Yeah. I like to say it's for your brain, your heart, and all your parts. Mark and Rebecca asked, how might you counsel a patient who mentions they have success coping with ED from over-the-counter supplements, like from convenience stores? I think about those like Black Rhino and the Stud Stallion and, those like single pack pills that probably have God knows what, a little bit of Viagra and some caffeine in them or something. What would you say to a patient who feels like they're doing perfectly fine taking Black Rhino from the 7-Eleven?
They did a study on little kids, and they gave them a pair of Air Jordans, and they measured how high they jumped. And then they gave them another pair of shoes that were basically Air Jordans, but they weren't marked as Air Jordans. And they measured how high they jumped, and they jumped like 2 or 3 inches less than they jumped when they were when they were using the Air Jordans. And so, when you take Black Rhino or, Man Cave, Extend, there's a massive placebo effect that goes along with the process of paying money and taking something like that and getting amped up for the event that I think is responsible for a large part of what happens with those things. The other thing is a lot of those companies will load up those products with sildenafil,
Yeah.
And put things in there that shouldn't be in there.
I wouldn't take them. I wouldn't take something off of a rack in a convenience store. I mean, the worst case, I'd go to my urologist and get the $1 a day sildenafils. At least you know that it came through the proper.
Well, I mean, have you ever
instead of
eaten a convenience store hot dog?
No. Do you think I would ever eat a convenience store hot dog, Judd?
It's like, all you got to do is look at what food they're serving, or those cheesy nachos.
Exactly. They look like they would stiffen your heart immediately.
You get what you pay for.
Not the best place to be getting yourself.
Yeah.
Exactly. Yeah, I would definitely have someone who's coping with ED switch to going to a urologist. All right. Well, let's see. I think we really talked about top tools already. We've talked about erectile anatomy. We've talked about the 3 big reasons people come to see you. We've talked about your areas of expertise, and we've talked about the last 5 months of life with coronavirus. I think we've done a really great job. I think what I'd like to do is finish off with the last 3 minutes and just really talk about what Gainswave as a tool has done for your practice and for your customers, because I was a champion very early on with Gainswave, and I have complete conviction that and proof from hundreds and hundreds and hundreds of men that have gone to get them because they trust me, the same as they trust you as their doctor. And I'd like to finish this off with just, how is this transforming? How is Gainswave creating a transformational experience in the lives of men that you didn't have before you got it?
I think these men are so happy to be able to do something that they can choose for themselves, and that it's something that they can do that's healthy for their lifestyles, it's healthy for their relationships. And again, it's not a medication with a possible side effect. So it's been amazing, I think, in my practice, and it's brought in many men who otherwise would not be seeking care. And as a urologist, then I'm also making sure that there's other things that other things are not going on, like prostate cancer, and we're checking to make sure that their overall health is good as well.
Amy or Judd?
I would agree with that. I think, it's basically offering hope to a population of patients who have been resigned to having to take a pill, or, there's lots of patients who pills don't work, and Viagra and Cialis, they don't work, or they have, pretty serious side effects. And, people who've had ED for 10 years and, it doesn't work. Gainswave is not 100%, but it's probably 90% of my patients have improvement in their symptoms after a series of treatments. And I think, that people love that it's not just sort of a Band-Aid approach that's going to require continued Band-Aids, but that you're actually repairing the tissue, I think is really exciting. And I also love the fact that it's opening us up to be able to talk more about sex for both men and women, and really talk about that these new tools are out there. There's tons of other tools besides medications that we can start looking at that can really move us in the direction of health.
I love it.
Yeah, I think that's a great point. For me as a guy, erectile function is really central to self-confidence, self-esteem, self-worth for a lot of men. And so even having to take a small amount of Viagra for a lot of guys means that they're not as potent or powerful or as capable as they used to be. And so what I've really seen from Gainswave is that it really restores a sense of self-esteem, of self-confidence, of control over an aspect of their lives that they were beginning to lose. And so to me, that's, you take a pill, but as soon as 6 hours is up, the effects of the pills are gone. But the beautiful thing about Gainswave is that after you treat a patient, 6 months, 12 months down the line, you're still getting really good beneficial effects. And if you get someone on a maintenance therapy, that can push the decline of erectile function back 5, 10, 15 years.
Yeah. Nice. Yeah, I was thinking about, I've tried so many things over the years and made my husband try so many things over the years too. I mean, we're all the original biohackers. We do all this stuff and more to ourselves, right?
And you're the biosackers.
And what I'm currently like for myself is a combination of nitric oxide every day. I take my vitamin, mineral, I take my nitric oxide, and I take my fish oil. Those are my baseline for health on a daily basis. Those are once you hit 40, you gotta make sure you're getting your vitamins, your minerals, your fish oils, and your nitric oxide. And then you deal with whatever, genetic hand was dealt for you or what have you. So I think that's really important. And then for me personally, where I've netted out is I really like the VFit for at-home maintenance. That's been a breakthrough technology. I like getting a FemiLift treatment or two every year because I like the VFit works on the inside and the FemiLift really works mostly on the outer labia, the inner labia, the clitoral head, shaft, and the crura, the vestibular bulbs. It really keeps all of your vulva very nice and plump and innervated and able to get lots of blood flow. So I love the tissue, removing the laxity and all of those issues. And I like the O shot, the orgasm shot, the PRP to the clitoral structure. I like to have one of those every year. I remember when I got one when I was 55, the first one, I think I was so desiccated, it took me until the second one that I got to really feel the effects of it. And by the third one, I felt like I had dialed back my orgasmic sensation to how great it felt when I was 35. But now I was 57 and I was having much better orgasms and much better sex and the sensation of youth. So I love that little stack for me, for my ongoing self-care. And for my husband, I love for him to have his annual Gainswave treatment with his pee shot, and he takes nitric oxide. And in all honesty, his penis has more veins showing now than in the last 30 years. Taking nitric oxide has made his penis stronger and veinier and also pumping. I think he's randomly does it. And I think it really, really helps keep his hard on very firm and his penis looks amazing. So the kinds of things that you can do and the relative cost and ease of treatment is incredible. And I think that's the real story here today is that Amy, Judson, and Lamia are a beautiful representation of the kinds of doctors that are out there now doing these self-care down there. I like my hashtag self-care down there, restorative treatments, so that we 40 and 50 and 60-year-olds don't have to face a loss of our sexual connection. We want to stay young forever. We're already doing our Botoxes and our, whatevers, all those things. And this is just an extension of that. And the more that people like you, Mark and Rebecca, Erica, and others, the more that you normalize this and let people know it's available, the more we empower people to have that connection. So I just want to thank everybody who showed up today, and special kudos to our 3 doctors today. Thank you so much for taking the time to show up in support of Gainswave, who is a real thought leader in the industry. So thanks to everyone. I appreciate it so much.
Oh, and thanks to you, Susan. You're such a wonderful moderator. And it's great to be on with Amy and Lamia.
You're easy to love. All right, great. Well, we will end the session now. And if you need any of us, just reach out to us if you want to connect with any of the doctors or with Team Gainswave or what have you. And you know how to connect with me. And we'll see you on the other side. Have a great day.
Bye, guys.
Bye, everybody.
Bye.